I can see someone out there who's dealing with symptoms and have gone through the gamut of clinicians that they've attempted to try to solve the problem without success. And they might think, boy, it sure seems like knowing the right tissue, the right body part, the right structure that's at the root of the symptoms would be pretty important. Can you talk about that just a little further? Explain why that's not important and what's
Absolutely. I mean,
more
that
important.
makes perfect sense until we realize that a lot of people that don't have any pain at all have herniated discs
Yeah.
or have stenosis or degenerative changes, but it's not painful. So if you then have a patient that comes to you with pain and they happen to have a herniated disc, is that a match? Is the disc the cause of the pain? Could be. And typically we jump at that and say, here's the answer. But in fact, we know a lot of herniated discs don't cause any pain at all. And so, but if someone comes to us in pain and we can find a way to eliminate that pain fairly easily mechanically, we're obviously addressing the underlying problem. We're addressing the cause. We're not obliged to identify the structure. We can sit around all day and discuss what we think it is. And there's plenty of evidence to suggest that most of it is disc related, but that's beside the point. We've just found a way to abolish this patient's pain and get them better and get them on the road to recovery. And we haven't had to do an MRI. We haven't had to nail it down as a disc, even though that may be our strong belief for that particular patient.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.